Welcome to Advancing Health. Pediatric care is often especially hard to come by in rural areas. In this first of a two-part conversation, learn how two Georgia care providers have partnered to chart some innovative solutions to a long-standing problem.
Hi, I'm Elisa Despagochaga from the American Hospital Association. I'm really excited to be here today with my two guests who are going to talk about how they're addressing some of the demographic challenges that are facing our workforce across the country, but especially in rural areas. We all know with the aging of the baby boom generation and the smaller generations that are following, making sure we have enough clinicians to care for all of those who need the care is going to be a challenge for years to come. So I'm excited to welcome Dr. Sumner, Dean of Mercer University School of Medicine, and Marc Welsh, Vice President of Child Advocacy at Children's Healthcare of Atlanta, to share their sustainable solution for the children in their community and across their state, which is just a great model for others. So I'm going to start with you, Marc, to tell me a little bit about what your role is and how you work with your colleagues and particularly Dr. Sumner in advancing this work.
Well, thank you so much for having us here. So I'm the Vice President of Child Advocacy here at Children's, or what we are now referring to as community impact. And my focus through all my work is really to think about how do we do work outside of the walls of the hospital to improve health outcomes for kids. And that is inclusive of this rural work that we're doing and we're so excited to do, which is really saying, how do you build pediatric capacity across the state to ensure that kids across communities in Georgia have access to quality pediatric care? And so for us, as we endeavor on this, it was important for us to find a collaborator who knew rural communities and who was able to really say, here is what it's like in communities across the state. And for us, there was no better partner than the Mercer School of Medicine and the Rural Health Innovation Center, which is housed at Mercer. They provided not only the platform to do this amazing work, but really the expertise and understanding and lived experience of what it means to live, learn, play in a rural community. And it provided an opportunity for us to say, well, how do we make a difference in these communities?
Wonderful. Dr. Sumner, tell us a little bit about Mercer and your role there, and especially with the Rural Center.
Well, thank you again, as Marc said, for having us. We're excited about this effort, and it truly is exciting to be able to talk about it on a larger stage. Mercer is a school that was created in a private-public partnership with the state of Georgia. The university itself has been in Georgia since 1833, but the medical school was started in 1982 for the mission of improving health in rural Georgia and educating physicians and other health professionals who would work in rural Georgia to address the huge burden of chronic disease and to prevent disease in those areas. One of the most underserved areas in our state is pediatrics. And we knew that, and we needed guidance from experts, but we had connections. We do a lot of rural work. We know the communities. We have students who are largely from rural Georgia. We are a school that focuses on our rural mission. Georgia has 159 counties. 120 of those counties are rural. Geographically, it's large. And of the 120 counties, there are about 63 to 65 that do not have a pediatrician. And then even those that do may have one. Family medicine plays a major role in caring for children in Georgia, but we have a number of counties with no physician at all. And our counties are geographically large, so that it is very hard to access the care you need for a young family. So we were looking for an alliance to help educate us and then help us educate them to put them in the community. And we found Children's Healthcare of Atlanta. And I think what's happening is really transformational.
Well, it sounds like you found just the right partners. Now, we all know, at least those of us on the line, that pediatric care isn't caring for little adults, right? This is not they're just not smaller versions of the adult care that many are ready to deliver. I love the work, and I would love to have you tell me a little bit more. And again, Marc, I'll start with you, to really ensure not only that you are making sure that that next generation of pediatricians is ready to be in those communities through your partnership, but what you're doing to help those smaller, more rural hospitals be ready, because kids still live there. How do they make sure that they're ready to treat those kids who might come to their front doors looking for care?
No, absolutely. I think, one of the things for us at Children's Healthcare of Atlanta that is core to this is we wake up every day thinking about kids. And what you said about the fact that kids are not little adults is core to how we operate and how we think here. And so as we looked across the state, we wanted to make sure that we were providing that expertise to organizations across the state that are doing tremendous work in our rural hospitals, but are typically adult focused and needed that support. And so at the beginning, we really sat down with Dr. Sumner, and Dr. Sumner brought folks from the community to really share insights on what do our rural communities need. And we landed on four core initiatives. The first really centered around exactly what we're talking about, which was building capacity in these facilities to treat kids. These are in large part adult facilities, but we wanted to ensure that when a child comes through the doors, that those wonderful folks knew and were equipped on how do we best serve those kids. And so that means, do they have the right equipment? Do they have the right training? Are protocols in place to ensure that they can meet the needs of those families? Because we know that the best care can be offered when a child is able to remain in their community. We're going to be here in Atlanta and we'll continue to be here to support families across our state. But first and foremost, we want to know that they're able to get care closest to home. And so that was part of this work. And we've done work with almost 30 hospitals focused on building that capacity within their facilities. The second bucket was there are amazing pediatricians across our state, and they are doing wonderful work in rural communities. But what we heard from those pediatricians was they often feel isolated and they don't feel connected in the same way that pediatricians feel in Atlanta. There's not a colleague down the hall that you can run something by to say, hey, what do you think about what I'm seeing here? And also, there's a lack of subspecialists around our state. We know that we have that crunch across the country, but certainly as you look in rural communities. And so we wanted to make sure that we were creating a network of connection amongst those rural pediatricians, but also an anchor back to experts here in Atlanta that could provide the guidance around, what should you be looking for in this particular case, and access to subspecialty care through telehealth. So really making sure that those bridges existed. The third area was mental and behavioral health. And we know that that's a huge concern across our nation, across our state, but especially in rural communities where access to care remains limited, but also there's huge stigma that remains. And so we wanted to make sure that there were programs that focused on screening, but more importantly, connection to services. And the last was building the workforce. And so we'll talk, I'm sure, a little bit more about the workforce across the state, but ensuring that we were creating a platform where we were allowing young people to not have to worry about how med school would be paid for. And in exchange, they were committing to returning to rural communities to serve kids.
Absolutely. Dr. Sumner, one of the things that I know we talk about a lot here at AHA and is the challenge where in medical school traditionally and in residency, much of the training is done at a place where you've got, 26 specialties on speed dial, right? You can page whatever you need at whatever subspecialty level to help you with what you're doing. And yet in some of these rural communities, it is you and then whatever network you have to be able to reach out. So how are you doing that work in training and in preparing those students to be ready to build this network and work through programs like what you've set up with Children's of Atlanta?
That's an excellent question because I get the question all the time. How do you make these young people go back to rural Georgia? I don't make them do anything. We pick the right students. If you look across America, 4.3%, according to the AAMC, 4.3% of students in MD programs grew up in a small town. At Mercer, we're about 50%. So we're 70% outside of metropolitan Atlanta, and 80% of Georgia lives in metropolitan Atlanta. We value our Atlanta colleagues, obviously, and they will certainly have a chance to get in, but we're looking for young people who love where they grew up and want to serve. We know, and I say this cautiously because I have a lot of friends in cities and I'm sitting in a city. I laughingly tell them that nobody's a bad doctor in a small town because everybody knows what happens. It's very close communities generally. We focus on first selecting the right student. We were the first in the country to do problem-based learning, which is starting with cases. And it really does help the way a physician thinks through their life to really go down to the basic science, take the case, take it to the basic science, bring it back up to the clinical arena. We also focus on excellence in clinical skills, the ability to talk to patients, the ability to get a comprehensive history, a comprehensive physical exam, because you often don't have the latest or greatest MRI or CT. So you need to do do it the other way and actually talk to the patient and examine, and then use the diagnostic tools that you have. So our students are well prepared to go into the clinical arena. But during their 4 years here, first, we have an accelerated track, which is 3 years, but both tracks, our students spend a lot of time in a rural community in Georgia with physicians that we carefully select who are great role models with excellent skills and enjoy their work. So we give them that opportunity to get out there and see the amazing transformation that somebody can make in a community if they're embedded in that community, live there, and then go back home or go to a neighboring community. Really good medicine is practiced in small towns, and rural hospitals are valued partners in this continuum. They don't do everything, but what they do well. The problem with pediatrics is they don't have large volumes, and everybody in healthcare knows if you don't do something regularly, your skills get rusty. So we focus on making sure those skills at home are good, our students rotating with the best of the best out there. Then thanks to Children's Healthcare of Atlanta, we have scholarships for any young person who wants to be a pediatrician and go back to a rural community.
I love that you've really partnered to make sure that the care is available where it needs to be available, but also you have that backup, that way to keep up their skills. As the grandchild of a very small town doctor, I can tell you there are people in that town who remember him, 40 and 50 years after he passed away, just, and with gratefulness. And I know the impact that he made on that community. So I can just imagine in your communities, the impact your students are able to make. I want to expand a little bit on that work on behavioral health. And Dr. Sumner, I'll start with you on this one. That is one of the areas where I know primary care in particular feels challenged. They sometimes don't feel like they have enough experience or enough training or enough learning time in that behavioral health space to really be able to support the care needs of their patients. So how are you thinking about making sure that you're integrating the mental health with the physical health from the very beginning?
Mental health is physical health, and it has to be closely integrated into every case. If it's nothing but the stress of learning you have diabetes. But really moving along, every student rotates on psychiatry. They work with therapists and people here in school, but we have a very close relationship with Georgia's Department of Behavioral Health and Developmental Disabilities. We also, we believe the first school in the country, we recently started an accelerated track in psychiatry. And so it's a 3-year track with a scholarship, and then you have a commitment to going back to rural Georgia. What Marc didn't mention is Children's also funds scholarships for our marriage and family therapists who agree to live and work. And we expect these scholarship recipients to live and work in their community and become part of those communities. But we see mental health is part of that physical health, and we do a lot of training in that area.
Marc, can you expand a little on your marriage and family therapy program then?
Yeah, I mean, I think it's a perfect example of how this collaboration has worked. We started with the pediatricians and we learned and said, this is working amazingly well. How do we extend this to other areas of concern across the state? And mental health is top of that list. And we wanted to do more there. And so we said, well, what would it look like to help build that workforce? And scholarships for our MFT scholars was an important piece. And the reality that we can get them into community much quicker allows us an avenue to say, in these communities where we're beginning to do screening, ensuring that we actually are getting those kids into care. Because you can screen all you want. If you don't have the care on the other end of the screening, then the screening is for naught and actually probably causes more harm than good. And so for us, it was important that these things are combined. And so as we start to do work in schools around screening, we need to be able to also say we have the workforce that actually can provide the care needed.
Absolutely. I always say don't ask the question if you're not going to do something with the answer. So I love that you are building that capacity not just at the physician level, but all the way through the team. Well, Marc and Dr. Sumner, we have a lot more to talk about in your great partnership. So we're going to turn this into a 2-part session. So stay tuned for more to come. And thank you again for all you do.
Thanks for listening to Advancing Health. Please subscribe and rate us 5 stars on Apple Podcasts, Spotify, or wherever you get your podcasts.